You're going to find 9 life-size Mani-Kids, 52 real-life scenarios, your educator manual, PD wheels, Broslo tape, challenge frame with timer, online access code corresponding to the online bag tag, and your answer sheets should you want your students to do it with pen and paper. From an educator's perspective, all you have to do to get started is simply choose one of the scenario cards. In the upper corner of the card, you have a picture of the Mani-Kid. You want to make sure that you have the corresponding Mani-Kid that goes with that scenario. Put that out with your scenario card. You want to grab your Broslo tape, your PD wheel, whatever cheat sheets you're using, put that out for your students. Grab your answer key, a pen, and that's it. You're ready to go. From a student's perspective, they will walk up and run the scenario. For example, 4-month-old who fell from a changing room table. She is unconscious and exhibiting spontaneous decorticate posturing. Also be sure to have them review the Peds Pearl quick tips along the side. So once they've done that, you'll start at the basic level. Answer question A. What color zone does this Mani-Kid fall into? Grabbing their Broslo tape, they'll measure red to the head and head to the heel, and that child is in the pink zone. The next question, what is the child's weight? And they'll flip the Broslo tape over and determine the child is between 6 and 7 kilos. Question C, how old is this simulated patient? So they will determine that easiest way on the PD wheel that they can find the age of this child. Under the tab marked answer key, all of them are identical to the page. Flip to number 12, because that is the scenario that they just completed. And then you're just going to put the answer key right up to their sheet, and you can go ahead and grade this, and that's all there is to it. That simple. If you prefer, you can have your students log in online. They just follow the instructions listed inside of the online access code envelope. That same code is also on the bag tag. Once they log in on their phone, they can see all the questions, answers, and short quick tip videos. By doing this, as an educator, not only do you no longer have to grade anything, but students will receive real-time feedback for their answers. Once they have finished all 52 scenarios in whatever period of time you decide, with a score of 80% or greater, they have completed the course. As soon as they submit the last scenario, they are immediately emailed a certificate with 13 Con Ed hours, which are approved for nurses, medics, and RTs. Your educator manual is the heart of this program. It makes using scenarios in seconds so easy. The tabs along the side are going to make it very simple for you to find everything you need. The very first one, your scenario index, this has all of your scenarios listed 1 through 52, and we broke them down into medical and trauma, and then we also broke them down even further. So let's say you want to run those respiratory emergency scenarios. All right, so then you can go through and find respiratory emergencies. Here, number 2, respiratory, number 4 is respiratory, number 6 is respiratory. Here are newborn issues, scenario number 1, scenario number 7. So we broke these down, again, medical and trauma, and then we also put along the side the Mani-Kid, so that way you know that you don't want to pull 2 of Mani-Kid A's scenarios, because you would of course be using it for a different scenario. So all of these are very, very simple for you to go through and find exactly which scenario and what the topic is for those scenarios. So that's your first tab. Then your next tab, this is your objectives and competencies. Yeah, we actually did these for you. So you photocopy these and you are able to use these in your employee files or in your students' files. Each and every scenario already has a competency written for you. Then we made 10 unique ways to play. This is just some fun ideas for educators that are looking for some unique opportunities to train. So then we also have the answer key. So if you are grading these or you just want to see the answers in advance, you have all of your answers, 1 through 52, they're all written. And then just a reminder, whether you're using a Brazos tape, a hand-heavy PD wheel, all of the answers work for both. So it's going to give you a range, because not all of the doctors agree on exactly everything. So your ranges are all in here, and that's already done for you. And then lastly, at the back of the book, we've created all of the sheets that are in here that you can photocopy. So if you accidentally use up all of them, you can get them out of the book here and just go ahead and photocopy those. And we also give you permission to make photocopies of those. And then we also created a record sheet. So if you wanted to keep score for your students, you could let them, you can keep this yourself and just keep track of each student. You just photocopy that as well. And then we also have this as ways to play that you create. We have lots of people who are constantly sending us these cool ideas. Well, this is a place for you to record some of your cool ideas. So photocopy this and keep stuffing in your ideas and keep continuing to build on scenarios in seconds. And then in the very, very back, we just found some great pediatric articles and other information that you just might want to go through at some point. And that's your educator manual in a nutshell.